Hello and welcome to Medicare 101. My name is Austin Thomas. My brother Brett and I are the founders and owners of Valley Insurance Services. We have over a decade of experience helping people with Medicare and health insurance, and this is our presentation that goes over the basics of Medicare and answers the most common questions that we get when helping people with this transition to Medicare coverage. So let's jump right in. So, question number one, what even is Medicare, right? Start from the beginning. So, Medicare is health insurance provided by the government for specific groups of people. Okay, the first group is those age 65 or older. The second group are those who have been disabled for at least 24 months. So, those receiving Social Security disability benefits for at least 2 years can also qualify for Medicare even before the age 65. The last group of people are those with ESRD or end-stage renal disease, basically kidney failure. They can also qualify for Medicare before turning age 65. Okay, so Medicare is insurance provided by the government for those three groups of people. Okay, and it consists of two parts. There's Part A, which is your hospital coverage, and your Part B, which is your medical or doctor coverage. Okay, that is what is referred to as original Medicare. That's what the government gives you as Part A and Part B. Question number two. So how do you get enrolled in original Medicare in that Part A and Part B when you're ready to go? Basically, there's three different enrollment scenarios of people getting onto Medicare, and we'll go over each of those. Scenario number one, if you're already receiving Social Security retirement benefits before the age of 65. If this applies to you, then you will automatically be enrolled into Medicare when you're turning 65. So you'll get your red, white, and blue Medicare card about 3 months before your 65th birthday, and your Medicare will start on that month of your 65th birthday. So there's nothing you need to do, starts automatically. Okay. Scenario number two, if you're not receiving Social Security retirement benefits yet, maybe you're still working, maybe you're just holding out until the full retirement age. Okay. If that's the case and you want to start Medicare, then that enrollment must be done manually. Okay, you can do that by setting up an appointment at your Social Security office and going and doing that face to face, or you can do that online through the Social Security website, ssa.gov. You can submit that application to start your Medicare. Okay, the last group are those people that are working past 65 and they have health insurance from their employer. Okay. For those people, you actually have the choice whether or not you want to go on to Medicare or not. You can delay your Medicare until you retire and just stay with your employer coverage, or you can go on to Medicare and leave your employer coverage. And we'll talk more in detail about that. Okay, right here, question number three. So if I do have employer coverage, what if I choose not to sign up, right? So basically, if you choose not to sign up for Medicare, there's two options, either safe or sorry, right? So option number one, if you have other creditable coverage, and this is what I was talking about, if you have employer coverage, that is creditable coverage, you're safe. You can delay that Medicare Part B until you retire, okay? And we have another video about those people that are working past 65 that goes over, weighing the options. Should I go to Medicare or should I go to, or should I stay with my employer coverage, okay? Option number two, if you don't have other creditable coverage and you delay getting on Medicare, then when you do enroll, you'll have a penalty, and that penalty stays with you forever. There's no way to get rid of it. Okay. So you want to make sure that if you don't have other coverage, that you do get enrolled into Medicare when it's time. Okay. So question number four, when does my Medicare start? It starts on the first day of your birthday month. So if your birthday is June 16th, it'll start June 1st. Now, if your birthday is on the first of the month, so if your birthday was June 1st, it would actually start May 1st. So it starts the month before on the first of the month. Okay. Okay. Moving on to the next question. How much does it cost? Okay. So Part A has no cost, no monthly premium, as long as you have worked for at least 10 years and paid your Medicare taxes, or your spouse has worked at least 10 years in the country, paid your Medicare taxes. then you will not have any Part A premium. Okay? Part B for this year, 2025, the premium, monthly premium, is $185 per month. That's the standard premium. Part B can cost more or less based on your income. Okay, so if you make above a certain amount, it can be higher, under a certain amount, it can be lower. Okay, but most people, the vast majority of people, pay that standard 185 amount. Okay, moving on to the next question. Does Medicare cover all my medical and drug expenses? And this is just if we're talking just original Medicare. If you just have that A and B, does it cover everything? Okay, so not exactly. Just to kind of go over some of the gaps that Part A and B don't cover. Okay, so in your hospital coverage, you have a deductible of $1,676. And that is not an annual deductible. That is a deductible that you would pay each hospital stay. So, for example, if you have to go into the hospital in January, before Part A pays anything, you have to pay out that $1,676. And then Part A will start paying its portion. Okay. And then if you have to go in the hospital again in June, you have to pay that $1,600 again before Part A pays anything. Okay. So that could really add up. Okay. And then with Part B, there's some gaps there as well. You have a 20% coinsurance. So what that is Part B pays 80% of the cost and you pay 20%. Now, there's no cap on that 20%. So if you have a $500,000 medical bill, you pay 20% of that. There's no limit on how much that can be, right? That could be a pretty significant amount. The other gap that Part B has is what's called Part B excess charges. Now, what that is that Medicare has contracted amounts with providers of how much they can bill for different services. Say it's a knee replacement, right? That there's a contracted amount with the doctor's office or hospital that Medicare says you can charge $10,000 for a knee replacement. Okay. Now, if that hospital or doctor's office wants to charge more than the Medicare contracted amount, they are allowed to charge up to 15% more. Medicare allows that. And if they choose to do that, Part B does not pay any of that up to 15%, right? If they charge 10% more, Part B doesn't cover it. That all gets passed on to you. Okay. So the other big gap is there's no prescription coverage. Okay. So now I tell you all this not to scare you because we're going to talk about how you can fill these gaps, but I just want you to know that if you think once I have my A and B from the government, then I'm good, right? That is not the case. You definitely need additional coverage, which takes us to our next question. How do I make sure I'm fully covered, right? So we want to make sure that we fill those gaps left by just original Medicare, just that Part A and Part B, okay? So to fill those gaps, there's two coverage choices, okay? There is a Medicare supplement route with a prescription drug plan or a Medicare Advantage route, and we'll go over both of these, okay? The way Medicare supplements work is that you have your original Medicare, your A and your B, a Medicare supplement plan that pays for those things that A and B weren't paying for, those gaps that we just talked about, okay? And then you would add an additional plan, that's your prescription drug plan for your prescriptions, okay? The way Medicare Advantage plans work is they actually lump all of your Medicare, your A and your B and your prescription drug plan or your Part D, they lump it all into one plan managed by a private insurance company, okay? And we'll go into more detail here. So let's first talk about a Medicare supplement, also called a Medigap plan, okay? So how do these plans work? So this chart gives you a breakdown of, on the left-hand side of the table, you see all of the gaps left by Part A and B. So you'll see the Part A deductible, that's the $1,600 that we were talking about. Or the Part B excess charges, that's that up to 15% that we talked about. Or the Part B coinsurance, right? That's the 20% that we just talked about. So there's others that we didn't talk about, but that's on the left-hand side shows the things that Part A and B don't pay for. Across the top, you see the different Medigap or Medicare supplement plans available and then you see how they pay on those gaps, right? So right off the bat, you can see that Plan F is the plan that covers pretty much everything at 100%. Now, Plan F is being phased out. It's only available to those who turned 65 before 2020. So if you're turning 65 now, Plan F is no longer available for you, okay? So the next best, we'd be looking at a Plan G. That's the most common Medicare supplement plan. And you can see it covers everything at 100% except for the Part B deductible. Okay, that is an annual deductible. This year, 2025, it's $257. So with a Plan G, you could set your budget by that, right? How much am I going to spend on medical expenses? $257. Everything else is covered, okay? The monthly premium for a Plan G, depending on the plan you choose, right now it's about $200 to $250 a month, okay? Now, if you keep going, the next best plan would be the Plan N, and that one, your monthly cost is about $50 less than a Plan G, about $150 to $200. And it's very similar in coverage. You can see that you do have some copays. You have a $20 copay for a doctor visit, a $50 copay for an ER visit. You still have that Part B deductible of $257. And the big one, and the main reason that we typically recommend the G over the N, is that the Plan N does not cover the Part B excess charges. That 15% that a provider is allowed to charge above the Medicare contract amount. They won't pay any of that. That all gets passed on to you. So most of the time, if someone wants a Medicare supplement plan, we recommend the Plan G. That's the most common plan. Okay? So another thing to note here, in that red circle there, you can use any doctor or hospital that takes Medicare anywhere in the US. So with a Medigap plan, there is no network. You can see any doctor that takes Medicare, okay? That's anywhere in the country. You don't have to worry about whether they're in network or not, okay? So then just a breakdown of cost, you can see on this page, you still have that Part B premium of $185 per month. You add a Part D plan, which is your prescription plan, because a Plan G doesn't cover any prescriptions. And that's on average about $15. And then you would add an additional about $220 on average for the Plan G. Those are your monthly costs going with that original Medicare with a Medigap plan. Okay. Another thing to note when choosing a Medigap carrier is that these are standardized plans. Okay, so what that means is the coverage of the plan is set by the government, not by the insurance company. So if you have a Plan G with Company 1 and a Plan G with Company 2, they're equal. Okay, the coverage is the same. So when choosing a plan, you're mainly looking at making sure it's a reputable company and looking at the premium, because the premium does change between the companies, but the coverage stays the same. Okay, now let's move on to the second option, which is the Medicare Advantage plan. How do those work? Okay, this is an example of a Medicare Advantage plan and how the copays look, or the benefits look. So right off the bat, you'll see that monthly premium is $0 per month. So no additional monthly premium. You do still have the $185 Part B premium, but then no additional premium. Okay, and you have copays for different services until you reach a maximum out of pocket. Okay, there's no deductible that you have to hit, but you do have copays. So you can see if you go see your primary doctor, there's no copay there, $0. But if you see a specialist, you pay $25. Then if you have inpatient hospital care, if you have to stay in the hospital, you pay $275 per day for the first 5 days, but then you pay $0 after that. So this is just an example of one plan. Then if you have enough copays that you add up to that annual out-of-pocket maximum of $4,800, then you're done paying for the year, and the insurance company will cover the rest. Okay? So looking at the breakdown here of Medicare Advantage. So you can see there in premium, in some areas, right, plan availability depends on the area, but it can be $0. Okay? In that first red circle, you'll see that in most cases, you'll need to use doctors who are in the plan's network. So this does have a network, right? So you're going to have in-network doctors. And if you go out of network, it's going to cost you more. Okay. The other thing with Medicare Advantage is they may offer some extra benefits that aren't included in Medicare, like vision, hearing, and dental. And also sometimes they'll include some extra perks like gym memberships and things like that. Okay. So with the monthly cost for Medicare Advantage, you only have that Part B, 185, no additional monthly cost, but then you do have some copays when you use your insurance. Okay. When you're choosing a Medicare Advantage plan, these are the factors to consider, right? Number one is the plan availability. So it varies by county. So that is one thing to note when you see advertisements or even that plan that I just showed you in the previous slide. That plan might not be available where you are. So it's important to, you know, work with a broker in your area or that knows your area so that you can know what plans are available, right? Don't always trust what you're seeing on TV advertisements that might be talking about benefits that might not be available to you, okay? Next thing you're looking at is the monthly premium, right? Some plans have one, some plans don't. And you're looking at the coverage for your medical, your prescription drugs. Another big one is make sure your doctors are in network. And then lastly, you're looking at the extra benefits that are important to you, whether it's dental or vision or anything like that. Okay, so question 10, which plan is better, right? Medigap or Medicare Advantage? That's probably the most common question that we get from people is, okay, which one's the best option? Okay, so if we look at a side-by-side comparison of a few factors in these plans, right? So if we look at network, right? Medigap is going to be a little bit better on the network side because there is no network. You can see anyone that takes Medicare. Whereas Medicare Advantage, if you want the benefits, you're going to want to stay in network, right? Monthly premium, right? If you really want to just save money per month, Medicare Advantage is going to be better because it's a much lower cost up front in the monthly premium. Coverage, Medigap is going to be better, right? With that Plan G, your only medical cost, no matter how many surgeries or hospital stays, is that $257. Okay, so whereas with Medicare Advantage, you have copays for different services and you have a maximum out of pocket of about $5,000. Okay, extra benefits, Medicare Advantage is better. A lot of times they'll include that dental and vision and hearing and those other things, whereas Medigap is just medical, right? So you can see that, you know, we have two check marks on the Medigap side and two check marks on the Medicare Advantage side. I honestly think that they're both good options. It just depends on what's most important to you, right? So if having the network flexibility is most important to you and having really good coverage, then the Medigap route is probably a good one to consider for you. Whereas if you're on a tighter budget and really want the lower monthly premium and you really want dental coverage and vision coverage and things like that that's more important to you, then Medicare Advantage might be the route to consider. So it depends on the person and what's most important to them. Okay. Okay. That another question that we get often is, okay, if I choose one, when can I switch to the other, or can I, right? So how often can I change my mind? Okay. So if you go with a Medigap plan, if you choose that Plan G and you want to switch to Medicare Advantage, this can be done each year during the Medicare annual election period that runs from October 15th to December 7th. So that's each year you have that ability to switch from a Plan G to a Medicare Advantage plan. Okay. That's also the time that if you're on Medicare Advantage, you can switch to a different Medicare Advantage or change your prescription drug plan during that time. Okay. Now, if you choose a Medicare Advantage plan and then you want to switch to that Plan G, there are some more barriers or restrictions going that route, right? Because when you're going from lesser coverage to more coverage, right, there are going to be some more barriers, okay? So the first option that you have is if you're first turning 65, if you're new to Medicare, turning 65, you have the ability to try out Medicare Advantage for 12 months. So if you choose Medicare Advantage, you have the first 12 months that you can try out. Anytime during those 12 months, you say, yep, I do want to switch to that Plan G. I want that coverage of the Medigap plan. You can switch, no questions asked, no barriers, okay? After that first 12 months, if you want to make that switch, you can, but you have to answer health questions and you could be denied based on your health. Okay, so if you've had any diagnoses or major health concerns, they could deny you that switch to a Plan G. Okay, now after that 12-month trial period, the other options that you have to move from Advantage to Medigap with no barriers is if you move outside of your plan's service area, right? So like we talked about with Medicare Advantage, plan availability depends on county. So if you're in a plan in Ada County that's not available in Twin Falls County, and you move from Ada County to Twin Falls County, that gives you the right to enroll in a Plan G without having to answer the health questions. Okay. Similar is if your plan decides to leave your county. So if you're on a plan that's available in Twin Falls County and they decide we're not going to offer that plan in Twin Falls anymore, then you would have the right to switch to a Medigap plan and you could skip the health questions. Okay, so a little bit more restrictions, but there are some options there. Okay, and the last question is just a plug of, why should I work with a broker? Okay, as a broker, highly recommend working with someone. If you don't have someone, please give us a call or reach out to our email or schedule a time to visit with us. There's so many perks of working with a broker, right? Enrollment advice, lifetime billing and claims service, right? We're here for you through the lifetime of the policy, annual check-ins and reviews with a licensed agent, and we don't charge you anything for our services. Okay, so if you have a broker you're working with, great. If not, we're happy to help you or support you. Okay, well, we don't have the ability to answer questions right now through the video, but if you do have questions, please reach out to us. We're happy to get in touch with you. Thanks for watching our Medicare 101 video. Hope you learned something.